joined today by Dr. Joshua Williamson, a pediatrician with Community Health and Dental Care. Dr. Williamson, thank you so much for joining us.
Thanks for having me.
So let's talk about forms of preventative care that are important for children.
In pediatrics, it's a major part of what we do. In fact, most of our schedule is blocked out for preventative care, and then, of course, acute care for everything else. But we see babies very frequently at the beginning of life. We see them when they first leave the hospital, and then at 1 month, 2 months, 4 months, 6 months, and then things spread out a little bit from there. And then our older kids we like to see yearly to make sure that they're growing and developing well.
To what degree do you think, the importance of treating children's, mental and emotional issues? Because it's a lot of physical work, but then there's also that side of it too.
It's huge, and I'm glad that we're having better recognition of these issues today. We use a lot of screening tools in our office to make sure that we're picking up any problems that kids are having, especially the older ones. And then for the younger kids, for the toddlers, we have to make sure that they're developing in a typical manner to make sure they don't need additional services or help to grow to the best of their abilities.
All right. Well, how much do you concern yourself with, a child's diet and the nutritional needs of a growing child?
We talk a lot about eating fruits and vegetables. We have a lot of picky eaters out there. I probably see one every day, and we talk about trying to incorporate some additional items into their diet. And part of preventive care is following our growth charts in pediatrics to make sure kids are gaining weight appropriately and growing well.
My daughter right now, peas. She eats peas. That's her vegetable that she eats, and she's 19. Can you give us some examples how a parent might integrate, a pediatric visits with other medical visits?
For our office, that's one of the most exciting parts because we have pediatrics. We have our dental suite right next door to our exam rooms, so our dentists work very closely with us. We have behavioral health. That team works with our new patients and patients that need some additional help there. Our case managers. We also have podiatry, optometry, physical therapy, and women's health, to name a few. We also have a great transportation team even that brings our patients in for us.
I love that. It really is a one-stop shop. And then you can consult each other very easily if there is something in one department that might need to, be addressed in another.
Absolutely. It's a great service we can provide, but it makes it a great place to work.
Well, Dr. Williamson, we are so happy that you came and joined us today on Community Connection.
Thanks for having me.